Welcome back to Healthcare on the Rocks, Employee Benefits with a Twist, where we blend insightful discussions with a dash of fun. If you listened to our last episode, you know we said goodbye to Jennifer Jones, one of our original podcast hosts from when we started 3 years ago. She will be missed, but I have an excellent new partner in Nicole Belles, our Senior Vice President of Product. Nicole, welcome to the spotlight.
Thank you, David. Yes, Jen will be missed, but it is great to be here representing Springbuk.
And we're happy to have you. So, Nicole, before we introduce today's guest, how about you tell us a little bit about yourself and your role here at Springbuk?
Sure. As you noted, I'm the Senior Vice President of Product. So I manage our great product team and our methodology team. I've been in the healthcare and data analytics space for over 20 years. So I'm really, really passionate about this industry. But we're thrilled to have with us Aaryn Pure, the Chief Commercial Officer at Hinge Health and a trailblazer in the digital musculoskeletal care space. So Aaryn, we want to thank you for taking the time to be with us today. We understand actually this is a pretty big day for Hinge. Your annual conference is happening right now. Is that correct?
It is. First off, thanks for having me. And we have over 350 of our clients, partners that we work with, health services companies, consultants, and hopefully future clients all here in Chicago for an action-packed couple of days.
That's awesome. I love those events. Like just the networking alone and like just learning from other employers and how they're using Hinge must be pretty incredible.
A lot of energy here. It's off to a great start, but yeah, I would wholeheartedly agree with you.
Cool. Well, let's jump right in and have you tell us a little bit about Hinge and your role there. What does your day-to-day look like in terms of expanding access to MSK care?
Yeah. Maybe I'll even just give you a little bit of background on me. So just real quickly, I'm actually based here in Chicago, where we're hosting Movement. Have 3 little kids here in the suburbs. I got 3 under 4 years old. So when I'm not focused on Hinge, I'm chasing toddlers around and try to sneak in around to golf from time to time. But prior to Hinge, I've been in healthcare my whole career. I started off working closely with providers at leading health systems to transition them from paper to electronic medical records. I worked for a public company here in Chicago called Allscripts. And about 10 or so years ago, left and was the first salesperson at a company called that would be called Livongo, one of the early pioneers in digital health. Held a number of different commercial leadership roles there over the years, and then fast forward, merged to Teladoc. I stayed on for Teladoc. I stayed on for about 18 months and led our employer business unit. And then, it's now been 2 years as the Chief Commercial Officer here at Hinge, where I look after our various sales teams and account teams, operations across the many segments we serve today. So back to your original question, what does my day-to-day look like? One of the things I love about the role is day-to-days can look very different. I do try to spend at least 50% of my time a week out in front of our clients, our partners, the market, if you will, to keep a good understanding of where not only how things are going today, but where things are going. And then, as a senior leader here at the company, there's a fair amount of internal work that needs to be done, forecasting, planning, board meetings, and all that other fun stuff. But it's always a mix.
So your experience is fantastic. It's very intriguing, like being able to have the opportunity to kind of work in different areas, all really focused on a condition management or helping an employer just make their population healthier, get people the access to the right type of care. Why is solving the musculoskeletal pain a mission that's close to your heart?
It's very relatable to me, but not just me. 1 in 2 Americans suffer an MSK injury or experience pain in a given year. So, and it's also one of those conditions that doesn't have a lot of stigma around it either. People don't like to talk, understandably, openly about maybe mental health or diabetes. But it's hard to, go to a happy hour these days and not hear someone complaining about back pain or waking up with a stiff neck or something like that, or, acute injury that they experience over the weekend. So, growing up as a, I'll give myself the benefit of being called an athlete for at least some period of my life, but I suffered from acute injuries and turned into lingering injuries, and now if I just carry the kids wrong, I got some lower back pain for a couple of days. But there's a lot of people today that are challenged with pain. I think last I saw, $600 billion is what pain costs here in the United States. About 450 million of that is attributed to MSK pain. So $450 billion, 1 in 2 Americans. And that's why, to your point, employers, it's generally a top 5 cost driver for most employers. Uncommon for it to be outside the top 5. And, not all healthcare problems have as clear of a path to reduce costs, maybe in my opinion. You can certainly improve the experience for other conditions like cancer and mental health. But MSK is a very clear path to cost savings, or clear cost savings opportunity. And if you can support people to work through chronic pain with exercise, physical therapy, non-invasive pain management tools like our Enso device, the downstream impact to costs, like imaging, office visits, injections, and most importantly, surgery, is very clear. And it doesn't take 3 years for the patient or the consumer to see that impact. It's weeks and months. And on the payer side, whether that's an employer or a health plan, it's we're generally able to show the return on investment in 12 to 18 months and not many years down the road. So, my personal run-ins with MSK over the years, but also just what a big challenge it is for all of us. Unfortunately, not the only challenge that healthcare face, but certainly a big one for us to try to solve for.
Yeah. And so I just yesterday contributed some portion to that $450 billion because I'm going through some therapy right now for a little bit of an elbow and shoulder issue. And so you were just talking about challenges there. So what do you think now I've got my opinion on this, but I'd like to hear yours on what are some of the main challenges with the current healthcare system's approach to MSK issues and pain?
Yeah, I got to ask first, that sounds like a pickleball injury?
Wow, how did you get
else?
that?
Oh my gosh, that's awesome.
That's amazing.
I just, I'm guessing some tennis elbow mixed in with some overusing or overcompensating with the shoulder, and
Yeah.
there's a lot of pickleball injuries these days.
100%.
So I got lucky there. But what challenges with the current system? It's a great question, David. I think it's a tough question. The problem is that I don't know what the statistic is. If I had to throw something out, I'd say over 90% of those that receive MSK care, the system is set up to cut us open. This doesn't mean that you go to your doctor, you tell them your elbow and shoulder hurts, and the next day you're on the operating table. But if you are referred to an orthopedic surgeon, because most primary care providers don't know how to or want to engage in MSK care, they may prescribe PT or pain management opioids, but the likelihood of your cost ballooning when you get referred outside of primary care, and that you endure more invasive care, it just increases dramatically. You'll get x-rays, you'll get MRIs. They will ask if you've tried PT. And even if the answer is no, surgeons will be putting you on a path for a quick or sustainable fix. And if you go get a second opinion, which you absolutely should, you will get more x-rays and more MRIs. In either circumstance, you may be referred to get an MRI within a local health system where that MRI is $3,500, when a standalone imaging center can do the exact same image and with the same machine for $400. But it's pretty clear that 30 to 50% of MSK surgery is deemed avoidable or unnecessary or ineffective, meaning that the pain or the issue is not addressed or not fully addressed post-surgery. So, we put patient through a very terrible, unnecessary journey that costs a lot of money for a surgery that doesn't always work. And, there's not real accountability for that today. Is it the primary care physician that made the original referral, the radiologist who read the image, the ortho who suggested and performed the surgery, or is it the healthcare system that has, been set up in a way that makes reimbursement for preventative care, more conservative care, much harder than it should be? So this is our opportunity at Hinge Health to deliver exceptional preventative or conservative care early on the MSK journey or the pain journey, so we can really deliver for that consumer and whoever is paying the bills for that healthcare, removing copays, making access easier, and being there for them 24/7 before the cost curve starts to really increase.
Yeah. Let's dig into that just a little bit more, because that is the big story here. And as you said in your intro remarks, your bio, you've got a lot of history in digital health companies. So what is it about Hinge that sets you apart from other digital health providers, and certainly from the more traditional approach that you were just talking about?
I think we are very focused on solving MSK, and there are other smaller digital health companies that are solely focused on one condition as well. But we're a pretty large company today in the digital health space, in terms of number of employees, revenue, lives covered, and we still want to focus on MSK. There is that much opportunity, that much wasted cost, that we believe we can build a very large, sustainable company that helps and empowers, millions and millions of people by just getting better and better at impacting MSK. And so, I guess the flip side of that are companies that try to do a lot of different things, right? They want to be in diabetes and mental health and cancer, and as we're seeing even the biggest companies that are so good at so many things struggle in healthcare, whether it's Walmart, who recently decided to shut down their virtual care, and there's plenty of others. Healthcare is hard, and you really got to focus on not too many things to increase your likelihood of having success. And so I look at the team. We have over 600 clinicians at the company, really focused on creating the best clinical experience possible. And then we have 600 people in our R&D organization, that's product and engineering, that are focused on creating an unmatched technology experience and marrying those two together to really try to create the best of both worlds. We're not just going to be clinical services. We're not just going to be a tech company. It's the marriage of the two that we're blending together that I think is setting us up well for success.
That's always impressed me about Hinge, your focus on innovation and your use of technology. And you briefly mentioned Enso, but could you tell us a little bit more about Enso and then other technology and innovations that Hinge uses to help manage musculoskeletal conditions?
Yeah, happy to. So, I think our philosophy, just from a product experience standpoint, at least today, it could always change, but is we want to own as much of that core consumer experience as possible. And, Enso is a good example, and I'll have another one as well. But, Enso is a non-addictive nerve stimulation device that sends high-frequency pulses into your body. It's about the size of a silver dollar, half dollar, and it can be worn, on most areas of the body. It's FDA approved device, seamlessly connected in the Hinge Health app. And depending on what part of the body and your pain levels, we can, or you control the amount of that frequency going into that body part. And it is time and time again shown to really decrease pain, both in the moment, but also over time. And so anyway, we acquired Enso maybe 3 or 4 years ago. It was predominantly being sold and used by the VA for our veterans. It's a delicate population when you think about opioid use and chronic pain and lingering injuries, and so we have helped the company commercialize it and integrate it into the Hinge Health experience. And now over 50% of our members are utilizing Enso as part of their pain and MSK treatment plan. The last thing I'll say is there's a fair amount of people that sign up for Hinge that may be in too much pain to even start physical therapy or exercise therapy. And so Enso is just a great way to help them start to alleviate some of that pain to begin to move again.
It's pretty amazing to me, the trajectory of the industry. So when I started over 20 years ago, working for a competitor, one of the first analyses that I did for an employer was we were going into the population and we were identifying physicians who were over-prescribing opioids for low back pain. And that was like just right at the cusp of physicians now being told that these were safe and that they could prescribe for pain management. And to now here we are in kind of an opioid crisis. So, Springbuk is really focused through our insights is in uncovering these opportunities in our employers' data and showing them and modeling to them what savings potential could be uncovered if they took certain action steps. And that led us into our Activate marketplace, where now we can actually partner, show them partners that can help manage these opportunities. And you spoke a little bit earlier about, populations at risk for invasive surgical procedures like knee and hip replacement. And we showcase that, or excessive imaging, and how the employers in our system can then go and find a partner within our platform like Hinge that can help them manage. How do you anticipate Hinge will continue to contribute and help employers and their employees' independence through the use of Activate?
It's a great innovation story. I think prior to the marketplace, what you've built, curated, best-in-class solutions, and help take data. Is it real time? Like how recent's the data?
Monthly.
Yeah. Versus waiting for their annual review and to get some high level slide on MSK is an emerging issue. And then I don't, even at the largest companies, benefits leaders a little bit under-resourced, right? So even if you know that it's a problem or exactly what problem you're trying to solve for, the bandwidth to go out and find best-in-class solutions and understand the impact that those best in, like the business case for investing, it's a lot. I mean, it's part of the job, but it's not like the core part of the job. So you all being able to kind of synthesize that data and surface the highest impact opportunities for clients, I think is a huge win. And I'd say that even for the largest clients, but especially for mid-market, large market. We all have our different definitions, but huge opportunity. And it's a great opportunity for us because it allows us to get closer to those clients that understand that it's a problem. We spend less time telling them or trying to convince them that it's a problem and they should look at their data. They already know that, and now they're kind of matched up with us on building the right solution for them to impact that problem.
That's awesome.
And tell us a little bit about who your ideal customer profile is right now. Is it a large company, medium size, small?
It's no secret we started calling on the largest companies first or early on. And as we've continued to grow Hinge, build some of these great relationships, 90% of the 600 plus deals that we will, or the 600 plus clients that we'll add this year, will come from 10,000 lives and below. So again, I know everyone has their different definitions. I talked very early on where most of our business today is with employers of all sizes, but again, most of the new partners will be below 10,000 lives. But we're also starting to see a lot of expansion opportunities in the fully insured populations, Medicare Advantage. We've built some special programming and services for the older adults, so fall prevention or balance program and some of these other pelvic health support areas to impact STARS ratings. And so, yeah, I think we're not solely focused on any particular market because, MSK pain isn't just in retail. It's not just in blue collar, white collar. But, just in terms of where the volume, most of our volume comes through today, it's kind of looks like the landscape of employers in America where most of the new additions are in that, 2 to 10,000 space.
Yeah, well, everybody has pain at some point, so it's a great thing that you're able to serve them all.
I had a quick follow-up. Yeah. Do you have a success story or a notable piece of feedback that you heard from one of the employers that is engaged with Hinge and is seeing a real impact on their population?
Yeah, we get it from employers and we get it from the actual consumer themselves. I think that's always kind of the most interesting part of movement. We'll have that session later today where we'll have a panel of users come up and talk about the life-changing impact that they've experienced. We've had people talk about how they never thought they would be able to go upstairs, that then started running marathons. Other folks that all they want to do were, get on the ground with their grandkids, and Hinge has allowed them to be able to get on the ground and play, or simple stuff that we take for granted, putting on socks. Those are the stories that you start to see people choke up a little bit in the audience because you get away from these big numbers of 450 billion and 1 and 2. These are real people that aren't able to have a fulfilling life, and we're able to impact that in partnership with folks like you all, the whoever's paying for the healthcare, the employer, and that's probably the most impactful part of our commercial kickoff, which is an internal meeting in a meeting like Movement, and then the client impact is great too. We have no shortage, at least today, of clients that are willing to get up on stage with us at big conferences and talk about the number of emails that they get from their own users about what an amazing benefit Hinge has been for them and their family, and or the cost savings impact that they've seen or reduction in healthcare utilization. So that's certainly the fun part of the job, where you start to get the great feedback from the market at both the consumer and the client level of what we're building here.
Yeah, that's a great impact to quality of life.
Yeah, for sure. All right, Aaryn, I know it's a busy day for you, so we're going to let you go soon, but tell us, if you would, and maybe this is something that you guys will be talking about today on the main stage, what's next for Hinge? We're eager to hear your future plans and how you see the landscape evolving.
Great question. We will be touching on our near-term roadmap here. Probably, I think it's our last session of the conference. But at the highest level, we are going to continue to make meaningful investments in AI. We don't believe it'll ever take the place of the care providers that play a very important role in care, not just for MSK, but outside of MSK. But making the providers as specialized, as impactful, as knowledgeable as possible by synthesizing, normalizing data, and helping drive toward the next best step. And then also using AI to really personalize the consumer experience as well. We have some new specialized pathways coming out very soon, especially across our women's health suite. So more on that. And then, not as I guess as impactful to most employers, but our fall prevention, balance, and some of the investments we continue to make in Medicare Advantage is an area that we'll be focused on over the next few months. We are not agnostic or against in-person care. We are trying to find the right hybrid approach to meet with people that do want in-person care, or that we feel a certain part of the care journey should be in person, and whether that's Hinge Health performing that or somebody else, a partner of ours or a network of ours. But our Hinge at Work offering, which is sending Hinge physical therapists to our clients' offices, has a ton of momentum right now. And so we're continuing to hone in on that and look at workplace safety, prevention opportunities, and that's certainly an exciting area that we're seeing a lot of momentum. But we have a number of strategic opportunities we're very much looking at, discussing almost weekly, that you'll probably see play out over the next 12 to 18 months, that are maybe a little bit more jump off the page innovation, but it's some exciting stuff. So maybe leave you with a little cliffhanger on that one.
Yeah. We'll be watching. No, that's a good point about balancing virtual and in-person care. I know, like, over the last couple of years, we've gotten more and more virtual, even myself feeling very comfortable having virtual office visits and things like that. But there's other members of different generations that need to be hold their hand into the virtual space. So that's awesome that you have that balance.
Are you talking about old people like me? You are, aren't you?
No, talking
Oh,
about
No,
my mom.
you're in the young athlete category, playing some intense pickleball, so very, very different.
Well, Aaryn, it has been an absolute pleasure speaking with you. If people want to connect with you or your team to learn more about Hinge, how would they do that?
Yeah, probably you can either just send me an email, Aaryn, Aaryn. So it's not O-N, it's Y-N, Aaryn at hingehealth.com. Or just look me up on LinkedIn, Aaryn Pure. Would love to connect with you.
That's awesome. Thank you for that. Well, that's going to do it for this episode of Healthcare on the Rocks, Employee Benefits with a Twist. Be sure to subscribe in your favorite podcast player so you don't miss an episode, and watch the Springbuk blog next week for additional content about Hinge and MSK issues.
And we will include links to Aaryn's contact there in our show notes. So be sure you check that out and then connect with them on LinkedIn for sure. Finally, please remember, take a second to give us a 5-star rating and leave a review on your favorite podcast platform. Be gentle, be kind. It's Nicole's first episode, so we want a nice 5 stars there. Nicole, thank you very much for hopping on, and I look forward to working with you on the rest of the series. Aaryn, congratulations on movement, and thank you so much for joining us today.
My pleasure. Thank you so much for having me. Look forward to seeing what reaction we get from the audience.
Yeah, it's great. Okay, everyone, that's it for today. Thanks for listening.